Well, nearly 500,000 residents who buy their health insurance through New Jersey's Affordable Care Act marketplace are bracing for major sticker shock as Congress continues last-minute talks over whether to extend federal subsidies that were beefed up under President Biden and are set to expire at the end of this month. State officials warn that without action, premiums could jump more than 170%, adding thousands of dollars a year for some families. The debate is happening, of course, right in the middle of open enrollment. Meanwhile, Republican leadership in the House is advancing a health care package this week that notably does not include the enhanced tax credits, but faces a difficult path to passage in both the House and Senate. Joining us now for all the latest is New Jersey Congressman Herb Conaway, a physician and former state lawmaker, to explain what it means for families and what, if anything, Congress can still do. Congressman, good to see you. What can you tell us about the latest on this potential vote in the House on the GOP-led bill?
Well, what I can say at the outset is that our Republican colleagues are not serious about protecting the health care of Americans. The failure to extend these tax credits for working families that desperately need access to health insurance to preserve their health and the health of their loved ones is not being addressed by this Congress. And therefore, in New Jersey, people will be facing very significant increases in their monthly and yearly outlay for health insurance, and many of them will simply not be able to afford those increases, which could, for some, amount to around $2,000 of extra health insurance costs over the year. And our estimates are that more than 40% of them will simply forego being insured.
As I understand it, House Republicans say that the package they're considering now would address what they say are the real drivers of health care costs. Are they right to be looking at this in the big picture, or how does that square with folks who are, as you mentioned, going to be facing those costs come January?
Well, they should be focused on continuing what works. We know that when the premium tax credits and were put in place under Obamacare, the ACA, whatever you want to call it, what it resulted in were over 20 million people being able to become insured. That means they could get their preventative care and they could get treatment for their chronic conditions. And if they had to go to the hospital for emergency or other treatment, that treatment would be covered and paid for through the insurance plans that they purchased on the marketplace, a bill that I sponsored in New Jersey some years ago. That has been threatened by the failure of the Republicans to address this issue. There's been plenty of time over the course of the year to come up with a plan, but essentially in at bottom, the Republicans are just not interested in taking steps to ensure that as many Americans as can possibly be insured are in fact insured. They're opposed to any plan. They haven't put forward a comprehensive health care plan in decades, and they've not put forward any kind of a serious plan here even now as these tax credits go away and will leave many people, certainly over 10 million people, perhaps 20 million people at risk of losing their insurance.
Well, one of the main arguments, Congressman, that Republicans have made against the expanded subsidies is that it allows higher income earners to qualify, folks, they say, who could otherwise pay. Is that a fair criticism based on the picture that you're painting about the system as a whole?
Well, they are wrong on that issue. You know, families of four and more are people of even middle-class income, who I guess they're characterizing as high-income owners, struggle to pay health insurance costs. And particularly when you look at small business persons. I had someone in my office just a couple of weeks ago. I meet with them regularly, and I've heard over and over again how important these premium tax credits are. And these are middle-class people. I heard last night, over this weekend, from a small business owner who's going to pay an extra $25,000 a year. We're seeing the same story over and over again. A small business person who has cancer, who has to remain insured in order to get her cancer treatment done. She can't forego it. And so here's the problem. If when people who are healthy enough but can't afford the dramatically increased costs of insurance now because of Republican inaction. Remember, every Republican in that House voted to cut health care in the United States by at levels that are unprecedented. Nearly $1 trillion out of Medicaid, $536 billion out of Medicare, um, uh, nearly $200 million out of the ACA. All of these costs, all of these steps, rather, have been taken in order to give an enormous tax break to the wealthiest people in the world. They had a choice. They sided with the wealthy, who can pay for insurance, platinum, gold-plated plans, or they could have sided with the middle class and people who are more economically hard-pressed than that, and take steps to make sure that they were able to remain in the insurance pool, remain insured, so they can deal with a critical issue.
Sure.
Now, next to the economy, the top issues, both of them together now for the first time in my memory, the economy and healthcare are neck and neck as the most important issues facing Americans today. And the Republicans have decided to do nothing, I would say, on either one of those things. But we're talking about healthcare today. They're doing nothing on healthcare, and it's going to hurt a lot of people.
Is there any talk about approving an extension of open enrollment to give folks some time, maybe, so that they don't have to choose a plan, just in case there is a breakthrough here, even if it's late? And second part to that question, how likely is a breakthrough? I'm thinking about folks looking ahead to the political fallout as they face midterms in 2026.
Well, apparently, it was reported that the president floated the idea of an extension of the premium tax credits, and that was roundly rejected. In the Republican caucus in the House, you have perhaps 50 members who simply do not support the program at all, and they certainly are not going to support an extension or even the premium tax credits that were put on in the wake of COVID. They don't believe that the government should be involved in any significant way in helping people to be insured. There are many Republicans in close districts who understand that this issue is going to be very closely tied to their political future and want to take some action. But when you have, large numbers of the Republican caucus in the House who think that the ACA should never have been passed in the first place, and who think we're spending too much on Medicaid for the poor. And by the way, I think it's very important for people to understand. They might be going after the poor and the middle class, but everyone, regardless of your economic status, are going to be in the pointy end of these cuts to healthcare. Again, the most massive cuts to healthcare in our nation's history will impact everybody, rural states, urban areas, the rich and the poor, because when you lose Medicaid dollars, when you lose Medicare dollars, when you lose ACA dollars, hospitals close, clinics close, nursing homes close. And as I don't need to tell anybody who's listening, it turns out that the rich and the poor alike need hospitals, need clinics, need nursing homes. And so, and we're already seeing the impact of closures in a lot of red states. A lot of people who voted for the president and the Republican leadership across the Congress are, I think, regretting that vote, because now these Republican roosters are coming home to roost, if you will, and they're understanding that they are going to have to make a very difficult choice of whether or not to go into the future without insurance coverage. And we know that there'll be tens of thousands of unnecessary deaths that will occur because people are now going without insurance. That chest pain gets ignored. The bleeding from some orifice gets ignored.
Right.
The heart attack that you have where the hospital that was nearby closes and now you have enough extra hour, an hour and a half to get to the next hospital, people are going to die on the way, die of a stroke on the way. That's what's coming because the Republicans are failing to act to secure health care for the American people.
All right, Congressman Herb Conaway, thank you so much for your time, for your insight. We really appreciate it.
Appreciate your interest in this. It's an important national issue. I just wish our colleagues would work with us to find a solution that works for everyone.